any problem with the classification? No problem. Okay.
No,
Selective
sir.
beta blocker. Selective beta blocker name start from A alphabet till M. Non-selective beta blocker name start from N till Z. Any name, okay? So easily can memorize. Alpha and beta blocker. Beta blockers at the end they have a name L, OLOL, OLOL. You can see every drug. OLOL, OL, OL. Okay? How about this? Alpha and beta combine. Also block alpha, also block beta. These drugs very helpful in heart failure. These two. And also very safe in pregnancy. Okay? This I am teaching you here second drug safe in pregnancy. Number one, alpha methyl dopa. Alpha methyl dopa for pregnancy induced hypertension. Second one here, this one. Alpha beta blocker combined. Also block alpha, also block beta. So at their end, not OLOL, ALOL, okay? Labit alol, carvid alol, carvidalol, labetalol. Okay, done. Okay, now we talk about the uses. What are the uses? Beta blocker use. We use for angina. For angina, we can use selective beta 1. Better use selective, okay? Better use selective beta 1 to use for chest pain. The patient having chest pain. If you block beta 1, it decrease heart rate. Yeah. So when you decrease heart rate, muscle oxygen use will decrease because the artery, the coronary artery disease, in coronary artery blockage, yeah, the blood supply less to the heart muscle. Understand? So if you decrease the heart rate, decrease oxygen use. The demand decrease. When demand decrease, the patient chest pain, now patient feeling better. The beta blocker we use for angina patient. This I will explain in MI angina, okay, in detail. A lot of drug we use in angina and MI. In CVS system we discuss again, okay. Use for MI. Then go for beta one. Preferred selective one. Three very famous names: atenolol, bisoprolol, metoprolol. Not forget these three names, okay? So if any patient with diabetes, having heart problem, any patient hypertension, having asthma, like this, okay? Hypertension, having diabetes, combine. So first we go for selective one. If you want to treat hypertension, having diabetes also, hypertension, having asthma also, to go for these three drugs. Atenolol, if you want to use beta blocker, okay? If you want to use beta blocker, which beta blocker I can use for the patient having diabetes, having hypertension, having asthma, having everything at the same time, okay? So go for three drugs: atenolol, bisoprolol, metoprolol. Atenolol, bisoprolol, metoprolol. Understand? For MI patient again we use this beta blocker. Beta blocker we use also with nitrate plus calcium blocker. Many drugs we use in MI and angina. Okay, quickly. That we discuss in detail in series system. Okay, next Beta blocker used for hyperthyroidism. Hyperthyroidism. Very high level of T3. This T3 change to, if you remember physiology, T4. Yeah. How T3 change to T4? Enzyme deiodinase. This deiodinase present in tissue is known as peripheral deiodinase. Okay. In hyperthyroidism, the patient having what about blood pressure? High. In hyperthyroidism, this you know. Hyperthyroidism T3 T4 stimulate sympathetic system. So which beta blocker very effective in case of hyperthyroidism? You can use selective one beta one. Beta one only act on like heart. Beta one decrease heart rate. Okay, so they can reduce blood pressure. You can go for anyone, atenolol, propanolol, metoprolol, visprol, any drug. But the very gold standard drug preferred for hyperthyroidism also block this is a extra action, like saying tamsulosin. Why you give tamsulosin for BPH? Why you not go for phenoxybenzamine phentolamine? Phenoxybenzamine phentolamine also used for BPH, but preferable drug tamsulosin because the problem was prostate enlarged. Yeah, tamsulosin help in decrease size of prostate, help in decrease size of prostate also, not just block alpha 1 receptor and relieve urinary retention. So you prefer them solution over phenoxybenzamine and phentolamine. Understand? So here we have big list of beta blocker. Which beta blocker you prefer in case of hyperthyroidism? Propanolol. Propanolol having Propanolol having two things to do. Also block beta one thing. Okay. Also block this enzyme. So in hyperthyroidism case, this T3 converted to T4, then it will lead to overactivity. Yeah? In hyperthyroidism patient, preferable drug propanolol. Another use, migraine. Migraine prophylaxis. Migraine, we can use three drugs in migraine. One, triptan. Second option, calcium channel blocker. Another option, beta blockers. For prophylaxis, if patient having migraine attack, that time you can go for triptan. The triptan, sumitriptan, sumitriptan for migraine patient. Okay, triptan family. So second option, calcium channel blocker. Another option, beta blocker. So we have option for migraine, beta blockers. In migraine, everyone know migraine having like the head half side pain. This side patient complain pain. Yeah, half half headache, half side. Okay, left or right side. It's a migraine. So migraine, you can go for beta blocker. Which beta blocker? Again, propanolol. Propanolol. So what happened in migraine? In migraine, one theory was migraine due to vasodilation in the brain. Vasodilation inside brain. Okay. Propanolol. Propanolol block which receptor? Beta 2 also. Yeah. Beta 1 also. Propranolol block beta 2. What happen in brain now? If you block beta 2, so no vasodilation, vasoconstriction. One theory for migraine, vasodilation. This vasodilation lead to pain. Okay, so propranolol causing vasoconstriction now. So we have option for migraine beta blocker. Beta blocker also used for migraine. Understand? Beta blocker used for migraine. Okay, next, beta blocker used for heart failure. For heart failure, which beta blocker you prefer for heart failure? First, go for selective one. Okay, selective one. Name atenolol, bisoprolol, metoprolol. Another alpha beta blocker. Alpha and beta blocker. Alpha and beta blocker. Two names. Let me know two name alpha beta. Same time. LO one Parvida. Keep in mind this drug, okay? Parvidalol very effective in heart failure. Labetalol we use in pregnancy, okay? Another use hypertension in pregnancy. Drug labetalol. Clear? Patient having hypertension only, okay? Single hypertension, not pregnant. Which drug you can use? Anyone, anyone. Go for propranolol, go for atenolol, go for any other like beta blocker. Understand? For hypertension, another use. Big list of uses. Glaucoma. Oh, also use for glaucoma. For glaucoma, we're having one drug. This drug only use glaucoma, only for glaucoma. Timolol selective or non-selective? Non-selective. Because after M, yeah? Beta 1 and beta 2. It have beta 1 action, yeah? So if you remember, ciliary body, yeah? Ciliary body produce ecosummer. Ciliary body have receptor beta 1. Beta blocker, if you block beta 1, so ecosummer decrease. Understand? So another drug for glaucoma, timolol, pilocarpine, okay, and timolol here. The drug used for glaucoma. Understand? Drug used for glaucoma. Another use hypertrophic HOCM. Hypertrophic obstructive cardiomyopathy in pathology, one type of cardiomyopathy. Must use beta blocker in this patient because one day this patient having angina. Okay, having angina one day. So we prefer beta blockers. Which beta blocker? Beta 1. So now we make the list here. Number 1 you use for angina. You use for MI, use for hyperthyroidism, use for migraine, use for heart failure, use for hypertension in pregnancy, use for hypertension, simple hypertension, use for glaucoma, use for hypertrophic obstructive cardiomyopathy. There are a lot of uses of beta blockers. Okay, many uses. Start from up to down in the eye, up to down. Migraine in head, yeah? Up to down side, migraine. In eye, glaucoma. In severe system, heart problem, angina, MI. Heart problem, heart failure, severe system, hypertension. Okay, now in neck, hyperthyroidism, clear? Another hypertension in pregnancy. Drug used for migraine. What the name?
Triptan.
Propanolol. Propanolol. Drug used for glaucoma.
Timon.
Drug used for angina. Anyone, okay. Beta blocker. Prefer atenolol, bisoprolol, metoprolol. These three must keep in mind, okay. Heart failure patient. Carvita, alol plus you also can go for atenolol, bisoprolol, metoprolol. For hypertension, you can go for any, for selective, also for non-selective, also no problem, okay. For hyperthyroidism, propane, alol. Hypertension in pregnancy, labetal. ये uses के लिए is all about beta blocker. We have another terminology about beta blocker, two beta blockers. Pindolol, not use these two drugs in MI in angina. Must keep in mind. Okay. Second, acetbutalol, not use these drugs, not use in angina, not use in MI. Okay, not use in heart failure. So these drugs must take care. Why? These two drugs, these are not poorly blocker. These drugs are partial, also have activity. These are partial agonist also. Like they are 50-50 drugs. The 50% block receptor and 50% chance to stimulate receptor. Clear? They have sympathetic activity also. Intrinsic sympathetic activity. Intrinsic sympathetic activity. So if you give to angina patient, they can increase heart rate also. Okay, so that's not good for heart patient, for angina MI patient. So must take care about these two drugs, indolol, acetylbutyrol. Done. Indolol, acetylbutyrol. Interaction of beta blocker with diabetes. What happened with diabetic patient? So if you're using non-selective, using non-selective, beta 2 receptor present where? Which
Alpha
cell?
cell.
Alpha cell.
Alpha cell release what?
Glucagon.
So if you block it,
Decrease glucagon.
glucose Clear?
Hypo,
So it causing what?
hypoglycemia.
So if you using in diabetic patient also taking medication for diabetes, you also using insulin in that patient. So you using beta blocker same time these three things. What happen? Very low sugar level. So here, if you want to use beta blocker in diabetic, you need to adjust the dose of insulin and these beta blocker. Okay, better to avoid non-selective. Understand? Better to avoid non-selective because it interfere with the sugar control. Done. If you're using insulin in patient for diabetes or any drug for diabetes, so beta blocker they also help to reduce blood sugar. Understand? So they can interfere with the management of the diabetes. What happened with asthma patient? Beta blocker interaction with respiratory problem asthma. If you block beta 2, it leads to bronchoconstriction, asthma getting worse. You must take precaution about this, okay? So for selective one, atenolol, bisoprolol, metoprolol. Even you using selective one, must take care about the dose. If you like using very high dose of bisoprolol and metoprolol, they also can act like non-selective. So when you're using beta blocker in asthma patient, first preference go for non-selective, sorry, selective one. But also take precaution, okay? Must take care about the dosing interval. Understand? So these are the all things about the beta blocker. All about beta blocker. Your sympathetic system almost done. Next we will start CNS CNS pharmacology. Okay, next system. Just a list, make a list and we finish class. CNS pharmacology, neurodegenerative diseases, neurodegenerative, Parkinson disease, and Alzheimer's disease. Drug use for neurodegeneratives, drug use for anxiety, drug use for depression, drug use for psychosis, and drug working like opioids, painkiller of opioids, another group drug used for epilepsy, one, two, three, four, five, six, almost six chapter of CNS pharmacology. One group also CNS stimulant is not. Two, three CNS stimulant we done here, amphetamine, yeah, amphetamine and cocaine also work like CNS stimulant, caffeine, nicotine, these all are CNS stimulants. CNS stimulants. Clinical things we need to learn about neurodegenerative, anti-anxiety drug, antidepressant, antipsychotic, anti-epileptic, and opioid. These main six groups. Okay? From tomorrow class we will start CNS pharmacology inshallah. If you have any question about sympathetic and parasympathetic pharmacology, you can ask. Try to revise it. It will helpful in other systems. In CNS, half 50% we again revise autonomic again and again repetition there. Okay. Try to memorize the action of the drug on synapse, sympathetic system, neurotransmitter. The breakdown, COMT enzyme inhibitor, monoamine oxidase enzyme inhibitor, two groups was there. Reuptake inhibitor also using in depression like this. Okay. all about today class. If you have any questions, then in group.
Yes, sir.
Okay.
Thank you, sir.
Assalamualaikum. Allah Hafiz.
Waalaikumsalam.
Waalaikumsalam.
Thank you, sir.
Welcome.
Pusing guys, pusing.
Chicken wings, pepper. Di TikTok. Kenapa, Wi?
Kalian nggak ingin melakukan sesuatu yang biar terekam yang gila gitu. Silakan.
Chicken wings, pepper.
Aku sekolah.
Bye-bye, annyeong.